You explained that there's a drop in energy levels in the brain when a concussion happens. So I am wondering if you know of any research regarding any supplements that may be helpful in restoring energy levels. I came across some articles online saying that creatine supplementation might be useful. Is this accurate, and are there any other supplements that may be useful? So yes, this is probably the one supplement that has intrigues a lot of people in terms of ATP usage. So what creatine monohydrate helps to do is helps to increase ATP production in the muscles, and that's why it's effective for people who are doing weightlifting. And that's how it increases body mass, because when your muscles would normally fatigue, they're able to pump out those last few reps, which ultimately leads to greater hypertrophy of the muscles, and that's why it's used in bodybuilding. Now, at the same token, the theory is that it might also be able to increase ATP within the brain. So concussion results in this ATP energy crisis, and so they've been studying creatine for a few years now, mostly in animal studies. I know that there's a few human trials underway, I believe in California. I haven't seen any published results from those yet, so stay tuned for the human trials, but I think theoretically creatine makes a lot of sense, and it has been shown in animal models to be effective at reducing the length of recovery time following concussion injury. So I would say that creatine would be one of those ones that you should be doing. And it might actually help to be taking that ahead of time as well, just because if you're increasing the stores ahead of time, if an injury does occur, it can be helpful at the back end. Some other supplements to consider. I don't have any for ATP directly, but one thing that concussion can cause is inflammation. Obviously, any injury is going to cause kind of an inflammatory response. Sometimes that inflammation can get a bit of a hand and can kind of beget more inflammation. It becomes this cyclical process. And so typically what we recommend immediately post-injury is trying to avoid foods that are known to be pro-inflammatory. So things like dairy, gluten, alcohol, refined sugars, those types of things can create inflammatory responses within the body. And if you have any type of injury and you increase that inflammation, that could increase the long-term effects of the concussion injury. So typically for us, we tend to, there's some evidence too on caloric restriction and that type of thing. So we typically go to this kind of avoiding of pro-inflammatory foods. There's other supplements such as magnesium, which can help to, if your magnesium stores are sufficient, it can actually help to prevent as much of an ATP decline. So this is one of those ones, magnesium would be one you should be taking prior to the injury to help keep those magnesium levels high. There's all sorts of these ones. There's ones that can reduce inflammation, omega-3 fatty acids following concussion, and also before concussion have been shown to be effective in, again, animal studies. Some people are proponents of a high dose of omega-3s immediately following injury. Very, very, very high dosage. I'm not sure if that's necessary. Those are mostly theoretical at this point from severe brain injury cases. So there's a lot of interest in the supplement space. We actually have a sport naturopath who's part of the advisory board for Complete Concussion Management. He does our entire nutrition lecture, which is about 3 hours long. And I don't think that's in the level 1, but if you are interested in that, in our clinical certification course, there's a full-on module where he talks about all sorts of different supplements and all the evidence to support or refute those. So I'm not necessarily the expert on the supplement side. This is kind of secondhand regurgitation of what I've learned from him and stuff that I commonly recommend to my patients have been found to be effective. So not an exhaustive list, but definitely creatine there is some evidence on in the animal studies, and there are human trials underway right now.